and always in medical billing and insurance specialist, fitness trainer, nutrition wellness coach, pharmacy technician. And today our webinar is a short webinar regarding one of the courses from medical billing and insurance specialist. I just wanted to present to you some of the highlights of what we as a student will be learning. Um, this is one of our courses from medical billing and insurance specialist, which is also called as healthcare reimbursement. That course, we learn about healthcare, different types of health insurances. The biggest topic nowadays is after it's insurance, and that's one of the things that the United States people and individuals worry about. So this chapter, we learn about history of insurance, explain reasons for rising cost, discuss affordable healthcare plans, reform, discuss legal principle insurance, and state four concepts of valid insurance contract. Learning the effects, difference between an implied of health insurance. So what is health insurance? Why do we need health insurance? Basically, health insurance helps. It's basically a way for the individual and a physician to get paid, and the individual should be able to pay the rising costs or the office visits and procedures that they have done by providing the patient or the individual with a means of having um, contract contracted amount. So it's actually an implied contract. So the physician and the patient agrees. Patient agrees that he'll see the physician, and the physician agrees that he'll treat the patient based on the fact that the insurance company, which is the third party at that time, will pay for the visit or the procedure. So basically, history of insurance in the United States. So our webinar is a small webinar, so we will just short it out. There are several slides in my presentation, but I just want to point over the main concepts. And I would really love if you guys are able to see this and decide to take admission in our program. History of insurance is one of the world's largest businesses. Health insurance offsets the cost of illness. Medical costs have limited insurance coverage options. Therefore, patients may need sometimes more than one insurance. So the policy basically is major medical policy, that is benefits that are extended to offset medical expenses caused by prolonged illnesses or serious injury. Insured is the individual that is under that insurance policy, is also known as the subscriber, member, policyholder, or the recipient. Recipient in this case would be the spouse, kids, the family members. Classifications for renewals is if the insurance should be cancelable, optionally renewable, or conditionally renewable. And all of these depends on the policy terms. So it depends on the premiums, it depends on deductible, and then coinsurance. So what is premium? Premium basically is monthly, quarterly, or annual fee that keeps the insurance active. So if you get insurance from your work, there's a monthly premium that they pay from that comes out of our paychecks. Deductible is an amount that's paid each year to allow the policy benefits to begin. So if your deductible is 200 or 250 per person, in order for that insurance to be active, the person has to pay 200 or 250. So anything that is within that cost will need to be paid by the patient. And once it's done, and once it's paid in full, depending on the insurance will cover the cost, or the person or insurance will pay everything for that patient. Co-insurance or co-payment basically is a cost sharing requirement. So it's a percentage or a fee that the patient pays for the covered services. So it can be $15, $20, or $25 depending on what type of physician you go to, if you go to a primary care physician or you go to a specialist. So basically how insurance billing occurs is we see the information from the patient records, code diagnosis and services that are rendered, we complete an insurance claim form, we post entries to patients' financial and accounting, and we follow an up on all unclaimed uh, records. When the patient has more than one insurance, then the insurance company needs to coordinate the reimbursement. So that means depending on what is the primary, what is the secondary, the patient then needs to see what needs to be paid by the primary and what needs to be paid by the secondary insurance. This is so that there is no duplication or overpaying or lapping of payments. So exclusion is an injury or illness that is not covered by the insurance policy. So it can be, examples would be on-the-job injuries, pre-existing conditions, which is like a condition or a disease that you might have when you uh, went under that insurance and it became active. So it can be diabetes or blood pressure. It can also be attempted suicides. A lot of insurances do not cover those. Requirement for pre-approval basically is eligibility, pre-certification, it needs to be pre-authorization or predetermination. And then you have choices for different types of health insurances. You can have an individual contract or you can have a group contract. Individual on contract is as an individual, you take the insurance for yourself and your family. Group contract basically is one that people get through their jobs or employer. So you have income continuation benefits for that. You have medical savings account. You have a health savings account that's provided to you by the insurance and your employer. Health reimbursement account, flexible spending account, and then high deductible health plans. So the health plans will have a high deductible, but you might not have to pay that much, or you might not have to pay any co-insurance when you go and see the physician. Types of insurance coverage: we have comparative medical plans, we have disability income, exclusive provider organization, we have medical cares, health maintenance organization, indemnity, or individual practice association. And then we also have independent or individual practice association. Then there's a special plan that covers maternal and child health programs, which is only compared for maternal and child. And coverages may include Medicaid, Medicare. Both of them are state programs, or an individual might be in Medicare, Medicaid together. Point of service, preferred provider organization, which is a PPO, state children health insurance plan, which is provided by state to parents to cover their child. TRICARE, unemployment compensation, then Veterans Affairs, Veterans Health Administration, which is CHAMP VA, and workers' compensation. So when we are as medical office specialists, when we are filling out the claim forms, we use CMS 1500 or health or HCPCS form, which is 1500. We learn an example would be this is a financial statement, which is a ledger card. An example of the form is the one that consists of all the information for the insurance diagnosis. So this would be this was a presentation of one of our classes, courses in medical billing and insurance specialist. We hope that you liked it, you enjoyed it, and we really do hope that you do consider taking admission in our institution. Our institution is online institution. We are Skokie Institute of Allied Health and Technology. Our medical billing and insurance specialist program provides you with ICD 10 training. and also provides you with online internship. Student actually goes through the whole process as if they were working in a medical office. They do billing, they do claim forms while they are in the program. The program is only 40 weeks, and now for winter term we are providing students 15% off with tuition and a free tablet. For more information, please do call 847-461-3985, or you can email us at info at s for Sam IAHT .org. So info at siaht.org. Thank you for listening to our webinar, and we hope you do join us again for another webinar that would regarding medical billing and or nutrition or health.